With increasing globalization, Singapore, like other many developed countries, faces greater economic volatility, sluggish wage growth at the lower end, relatively less social mobility, and a rising income gap between the haves and the have-nots. While our median household incomes have risen and more have higher salaries, there still are vulnerable groups of Singaporeans who may need more than a leg up over a longer period of time before they can catch up with the rest. The government needs to intervene in a timely and decisive manner to provide more support to lower-income Singaporeans to help them improve their lives and carve more and better opportunities for themselves and their children. I must, however, acknowledge and state for the record that the government has done quite a bit to help vulnerable Singaporeans, such as the elderly and low-income earners, through government assistance schemes such as the Community Health Assist Scheme, GST vouchers, ComCare, and Workfare Income Supplement, to name but a few. Minister for Social and Family Development shared with us in detail earlier today. Nonetheless, with the rising cost of living and inflation in the prices of food, housing, and transportation, affordability remains a challenge for the low-income earners whose salaries have not quite increased in tandem with the increase in prices, and for the elderly whose current savings from years of toil and sweat have not quite amounted to much in relation to today's prices of goods. Hence, there is still room for more to be done to help them. For instance, our ComCare assistance scheme can be streamlined and made easier to process and disburse to the beneficiaries. Some residents I met have lamented that from the time they apply for ComCare, they would have to wait for another 2 to 3 or even 4 weeks before they would be given the much-awaited check. While they are appreciative of the financial assistance they receive, they also get frustrated with the wait, to the extent that some of them will jump with annoyance at the mere mention of ComCare. As the Ministry of Social and Family Development, or MSF, introduces the first 10 social service offices in the heartlands, I hope that the processing and wait time can be improved. I would also like to propose that ComCare assistance be given for a longer period of time, at any one time, 6 months instead of the current 3 months. For many residents whom I have met and who have sought ComCare assistance, 3 months of financial assistance at the first instance is barely enough for them to find a job, wait for the next paycheck, and settle their arrears or debts before having a decent amount left over for daily expenses such as for food and transportation. Most of the time, they would have to reapply, and this would incur an even longer period of wait time. To enhance the ComCare assistance given to lower-income families, specifically those with school-going children, may I propose that MSF work closely with the Ministry of Education, or MOE, to identify the children from these families and extend transport and school breakfast vouchers to the children. These are important because the transport vouchers will help mitigate the cost of travelling to and from school and to ensure that the children continue to attend school, while the school breakfast vouchers will help to ensure that they are able to start off the school day with a good and healthy meal, despite the financial difficulties that the families are facing. Conversely, I hope that the MOE can also refer students who do not attend school regularly or who show signs of malnutrition to MSF so that a follow-up can be made to visit their families to identify those who are vulnerable and who may need further social or financial assistance. In other words, close collaboration between the ministries and agencies would be very useful. Another enhancement is the use of MediSave. I applaud the review of our healthcare financing, but I also hope that the Ministry of Health, or MOH, can grant greater flexibility in the use of MediSave by Singaporeans, not just for hospitalization or surgical procedures, in other words, recuperative or surgical procedures, or reactive healthcare expenses, but for preventive healthcare expenses as well. I spoke about this in the budget debate earlier this year, and as I did then, I would once again implore the Ministry to consider that Singaporeans be allowed to use our MediSave funds for preventive healthcare expenses, such as healthcare screenings, physiotherapy sessions, especially for the elderly, and dental checks, and also for antenatal medical consultations in both private clinics and restructured hospitals. One of my residents, Uncle Robert, whom I met during one of my block visits, is one such Singaporean who can benefit from such flexibility in the use of our MediSave funds. Uncle Robert lives with his wife, just the two of them, in a Spartan but cozy 5-room flat. His 3 children are all grown up, married, and live with their own families. While Uncle Robert and his wife are retirees and hence do not earn any monthly salary, they lead a simple but comfortable life with enough to get by. He insists that he does not want any financial assistance, nor does he want to ask from his children. But what he wants is to be able to be independent and spend his own hard-earned money for his needs. When I met him, Uncle Robert shared that although he was asked by his doctor to go for a detailed health screening at the hospital, he had been postponing it as he was certain one check would lead to another and the final hospital bill would be quite substantial for him, for out-of-pocket cash payment. He added that he has several $1,000s in his MediSave account, and all he wants is to be able to finance his healthcare expenses with his own money in his MediSave account. I'm sure many of us understand how Uncle Robert thinks. He feels a sense of dignity and independence because he can pay for his own expenses, medical or otherwise. Greater flexibility in the use of MediSave will certainly help seniors, such as Uncle Robert, to independently take care of their own health and well-being. Similarly, greater flexibility in the use of our MediSave funds will help expectant mothers mitigate their antenatal medical expenses, be it at the restructured hospitals or private clinics. Many expectant Singaporeans can benefit from this, such as Madam Rahima, one of my residents. She was expecting a second child when she came to see me for financial assistance. She relied on her husband, the sole breadwinner who worked as a security guard and earned about $1,200 a month, but who also had to pay alimony to his ex-wife and 2 other children. There was barely enough for Madam Rahima and her 2-year-old child each month. She did not go for her monthly antenatal checks as she could not afford it. However, having worked before, she had some funds in a MediSave account and was hoping she could draw down from her MediSave for her antenatal consultations. At the moment, under the MediSave maternity package, up to $450 can be withdrawn from an individual's MediSave account for pre-delivery expenses such as consultations, ultrasound scans, and tests, but only if this were done at the same hospital that they delivered the baby in. The claim for this pre-delivery expenses is made only after delivery at the same hospital. In other words, a reimbursement claim structure that requires upfront payment first, upfront cash payment first. So for someone such as Madam Rahima, this is difficult. I hope the Ministry of Health would consider granting greater flexibility for expectant mothers to draw from the MediSave account to pay for their antenatal medical expenses after each consultation, visit or test, whether at polyclinics, private clinics or hospitals, which may be different from the one they would eventually deliver the baby in, instead of the current reimbursement claim structure that requires upfront cash payment. In addition, I would like to suggest that the withdrawal limit for antenatal or outpatient consultations or treatments by expectant mothers be increased to at least $600. In the spirit of encouraging and helping Singaporeans have more children, I hope the Ministry will seriously consider making these proposed changes. A higher quantum would be appreciated, for sure. The introduction of MediShield Life for all Singaporeans is very much welcomed. Residents I spoke to have expressed their support for it, as this would help ensure all Singaporeans have a medical safety net to fall back on, should medical expenses be more than what the MediSave or out-of-pocket cash payments can cover. Even younger and more affluent Singaporean residents I met have expressed their willingness and support for prepayment of premiums while they are still young or while they can afford it. So this is good news. However, one concern raised by specifically older residents and those with lower income is whether they can afford the premiums for MediShield Life. This concern does not just come from older Singaporeans or those with relatively lower income, but several middle-income earners who have more dependents to support, such as young children, aging parents, or family members with special needs. The Pioneer Generation Package is a good start to help older Singaporeans pay the MediShield Life premiums, but I would like to urge the government to consider providing premium subsidies to these other groups of Singaporeans, the lower income earners and the middle income earners with more dependents to support. It is heartening to hear that the government will convene a committee to look into the premium and payout structure for MediShield Life. But in order to help Singaporeans adjust in the initial period when MediShield Life is introduced, the government can consider providing some form of financial support to those who need it. Yet another consideration is to increase the MediSave withdrawal limits for each Singaporean so that the premiums for MediShield Life can be paid fully from our MediSave funds. While it is recognized that the government has improved policies and programs with regard to social and financial assistance, the implementation and delivery of such assistance can be enhanced further. For one, accessibility, as spoken by members earlier today, of such assistance can be improved, where barriers to seeking assistance can be kept to a minimum or eliminated altogether. Easy access to such assistance will make it less frustrating for those who need it, and at the same time, help to preserve their dignity and sense of hope. Next, the government can do more to ensure affordability for Singaporeans. Social and financial assistance schemes can be reviewed regularly to take into account current income and cost of living trends, and for low-income families who are plagued by illnesses or extenuating circumstances, or those with young, school-going, or elderly dependents, additional support can be provided. Managing the cost of living and continued affordability of services is important to such families, and any additional help by the government will certainly be needed. Third, the government can provide greater flexibility in assessing the merits of each case applying for social or financial assistance, taking special circumstances into account when determining eligibility and the level of support to be rendered. This is so that families in genuine need can receive appropriate help even if they do not fit the criteria that have been set or only qualify for minimal help. Frontline staff can also be trained to assess such needs and exercise flexibility at the point of application for assistance. In addition, greater flexibility in the use of one's social security savings, in this case the use of MediSave for preventive healthcare, will develop a sense of independence and self-worth among our people. For all we know, it may just pave the way for better healthcare in the long run. And finally, there can be better coordination among the ministries, government agencies, and organizations that extend social and financial assistance to those in need and who are more vulnerable in our society. Better coordination will not just lead to greater efficiency, but also ensuring that the assistance rendered is more effective and targeted, and at the same time, reduce frustration and anxiety among the beneficiaries. This will require the seamless sharing of information, knowledge, and experience, and a collective belief that by working together, we are able to do our best in helping those who are vulnerable and in need. The MSF's introduction of the social service officers in our heartlands is a welcome move, which I hope will help realize this belief. At this juncture, please allow me to speak in Malaysia.
The ability to manage the cost of living is a concern shared by many Singaporeans, especially among the low-income group and the elderly. For the low-income group, increases in the cost of daily necessities, housing, and transportation will continue to pose challenges because their salaries will not increase in tandem with the increase in the price of goods. For the elderly, the savings that they accumulated over the years through all their hard work and toil will now not amount to much compared to the increase in the daily expenses and medical costs. While I concur that the government provided many assistance schemes for these groups, there is still room to enhance the assistance given to ensure that those who really need help will be given help. One example is MediShield Life that was introduced recently. Many of my residents support the MediShield Life scheme, but some are worried whether they will be able to afford the premiums to this scheme, especially those from the low-income group, the elderly, and those from the middle income but have many dependents like small children, elderly parents, or family members with special needs. I hope that the government will help these groups, whether through a Pioneer Generation package, premium subsidies, or by increasing the Medisave withdrawal limits, so that the MediShield Life premiums can be paid fully from the Medisave funds. Another way would be to provide flexibility to Singaporeans when they utilize their Medisave accounts, especially for our elderly, in order to pay for the cost of health screenings, dental checks, or physiotherapy sessions, and for antenatal checks for expectant mothers. This flexibility will help Singaporeans to manage the cost of living in terms of medical and health needs. With this, allow me to end my speech in English.
While I urge the government to do more, I would also like to make a similar call to each and every one of us, here in this house and out there, to do our part as well. Extending the necessary social and financial assistance to those in need and who are vulnerable in our society is not just the responsibility of the government alone. Each and every one of us has a part to play in making a positive difference in our society. We cannot simply stand by, criticize the government on what it has done, spew mere rhetoric on what it has not done, or showcase some form of intellectual snobbery on what more it can do. But where in reality, we have yet to do the real work of helping others and making that positive difference in the lives of those in need. While words matter, actions speak louder, but not nearly as often, as said by Mark Twain. Thank you, Mr. Deputy Speaker.
Minister Chun.
Mr. Deputy Speaker, sir, let me first thank Dr. Intan for speaking up on behalf of many Singaporeans, especially the poor and the vulnerable. She has spoken on many issues that are close to our heart, and indeed we'll try our best to do more and do better for all Singaporeans, especially for the vulnerable ones amongst us. As Dr. Intan says, the challenges are not unique to us: a widening income gap, healthcare costs going up faster than income for some of the members of our society. But having said that, we do start from a better base than many other countries, and we are committed to do more within our means to take care of all Singaporeans, especially the vulnerable. Dr. Intan touched on 4 themes which I think are most appropriate: flexibility, affordability, coordination, and timeliness. Let me first talk about flexibility. In order to achieve flexibility, we need to adopt a 2-pronged strategy. First, we need to design our schemes to be flexible and review them regularly to make sure that they are relevant. In this, I give an example of the public assistance schemes which we reviewed recently. Instead of a one-size-fits-all scheme, we now have different tiers to meet different needs. Likewise, for ComCare, we do have a different period of help extended to families in need, ranging from 3 months and even beyond 6 months. And indeed, I have told my officers that they should feel confident that they can make the judgment to extend assistance to families in need beyond 6 months. It is always a fine balance that requires the judgment of the officers to balance between premature termination of support and prolonged assistance that may inadvertently discourage independence. But it is something that we must equip our officers to make the judgment and to call the shots. But in order to do this, we have to do the second thing, which is to make sure that we strengthen the training of our frontline officers so that there is a certain consistency in their responses, and yet at the same time they have the flexibility and the confidence to make the call when the call requires them to deviate from what the guidelines may be. On the second issue of affordability, we adopt a multi-pronged strategy to ensure or manage our healthcare costs. The first strategy, as you mentioned correctly, is to make sure that we spend much more upfront on preventive and measures and staying healthy. If more of us can do this, actually it will reduce our overall healthcare costs. We have good news that for the CHARS scheme, we are going to expand it to cover diabetes, hypertension, high cholesterol, cervical cancer, and colorectal cancer. We will also look into covering some vaccination, prenatal checkup, and more complex dental procedures. So for many of these schemes, it will help people like Uncle Robert that you have mentioned. Another strategy that we have adopted to manage the healthcare cost is the risk pooling, which is why we're going to look into the details of implementing the scheme for the CPF, the MediShield Life. And yet another strategy is to make sure that we are disciplined in our treatment and right-side our services so that we can target our resources to those who need it most. In all these efforts that we do, we are going to pay particular attention to the pioneer generation and the lower and middle income group. At the end of the day, how much more flexible we can be with MediSave also have to balance the consideration to make sure that we have and provide for enough and adequate savings for old age and retirement. In the area of coordination, yes, we agree we can do much more and we want to do much better. It's not just between MSF and MOE, but we will also want to extend this coordination from MSF, MOE to MND, MOH, and many other agencies, including those looking for jobs. MSF and MOE coming together to take care of the young children who may come from a disadvantaged background to make sure that they have a proper breakfast is one such example. Another example would be the aftercare school services that we would like to provide for many of these latchkey kids. And we would also like to better integrate between MSF social assistance and MOH healthcare assistance, because indeed it is a continuum of assistance when it comes to taking care of our elderly. The recently launched program of Caring for Our Neighbours, or CAN, launched between AIC and MSF is indeed one such example where we want to provide a continuum of care from social to medical. We do not want to medicalize everything, but where we can, we will try to intervene early, upstream from the social dimension first. Other work that we are doing to make sure that the coordination between the various agencies are done better is first to make sure that we have an integrated database, which I have launched recently. We also want to put in place the network of social service officers across the entire island so that people have access to services in their respective towns without having to travel further than necessary. The social service officers will also allow us to do integrated case management, whereby they sit down regularly with people and professionals from other agencies, including the housing divisions, including MOE, including other ministries, to do integrated case management, because we precisely recognize that you cannot help people in one dimension and neglect the other dimension. In fact, that will detract and subtract from our efforts. We must make sure that the sum of our parts is more than the individual, and that is when we need to deliver the integrated package of help required to everybody. The Social Service Office will also strengthen the local planning functions to make sure that we have a system to mobilize the local community resources to come together to do this better. Very often it is the frontline grassroots community leaders who will help us to identify the people in need of help. But there's also some other things that we need to do, and that is that training and exposure of our social work professionals. In order to do that coordination across different agencies, they must know the capabilities across different agencies and what each agency is capable of, to draw on their strengths to overcome each other's weaknesses and deliver the integrated package required for help. Last but not least, Dr. Intan talked about the timeliness of intervention. Indeed, that is something that's close to our heart. The first dimension of timeliness is to make sure that we detect a problem and prevent the problem upstream. Much of this has to do with the community efforts. Many of the CDCs have many programs to make sure that families are socially integrated into the community, and the community plays an important role in picking up problems and challenges that these families, vulnerable families, may have. For example, in the example that you have used, a young child going to school undernourished or not without breakfast, the first line of defense is to be able to pick it up. Someone from the school, be it a teacher, be it somebody else from the school, is able to pick it up and highlight the case so that we can follow up. And very often when we follow up on the case, we realize that it's not just about the breakfast, but there are other issues related to the families that we need intervention. The second thing about the timeliness of intervention has to do with our staying power. Many of the cases that we come across are complex cases. It doesn't require us just to provide a solution at a point in time. It requires us to have the staying power to provide the help across a prolonged period of time. For many of the complex cases that we are handling now, we need volunteers. Volunteers and mentors, much more than even financial assistance, so that we can handhold the people to walk through all these dark valleys of life. And it is on that note that I will urge members of the public and the community to come together to help the fellow Singaporeans in the community in need of help. Very often, more than money, we need volunteers, we need mentors to handhold them and guide them and give them the sense of confidence to do this. Finally, let me say that while we do not start from a very negative position, we know our challenges, and our challenges will continue to grow going forward. This government is committed to do as much as we can in partnership with the community and like-minded individuals to take care of our elderly, our vulnerables, and to give Singaporeans that sense of assurance that they can age and grow old in their community with dignity. We will try to do our best to master the resources. As a member of the House, Mr. Zaki mentioned just now, it is not easy because going forward, our challenges will grow, our demographics and our aging population might restrict our ability to fund many of these things, and this is where we must really make sure that we target our assistance to those who really, really need it. But nothing can replace action, as you have rightly pointed out, because at the end of the day, we can all talk about this issue, but at the end of the day, we need to act on it. And we need to act on it because we want to take care of our fellow Singaporeans and do our best for them. And the only way we can do that is we have the help from everyone in the community in partnership with the government and like-minded agencies. If I may just end off with a short saying in Malay, kami faham beberapa orang-orang.
We understand that there are people who are concerned about these issues, but please do not be worried because this government understands these issues and we will work hard to raise the standards, our standards for all Singaporeans. Do not be worried. If you have problems, let us know and we will do our best.
Don't worry. My assurance to all Singaporeans is not to worry. Like what Uncle Robert says, don't worry. Because if there is a need, we will find a way because we have the resources. We are much better than what we were 30 years ago. And we will definitely do our best mobilizing the resources of the community and fellow Singaporeans to come and take care of our fellow Singaporeans. Thank you.